So my name is Basel Refky Abdel Fattah. I am an assistant professor of surgical oncology and gynecological oncology in Oncology Center, Mansour University. I am the general secretary of the Egyptian Gynaecology Society, and I'm a council member in the Pan-Arabian Research Society of Gynaecology, PARSGO, and a council or board member of the Middle East and Mediterranean group of gynecological oncologists, MIMAGO, as well as I'm going to serve in the European Society of Gynecological Oncology, ESGO, as a council member starting March 24 till March 28. So I choose to start my subspecialty in gynecological cancers, as my primary training was as a general surgical oncologist. But really, I have realized that there are many of pitfalls and unevidence-based practice or unstandard practice of gynecological cancers in our region, in our country, in between the gynecologist, general gynecologist, or even the surgical oncologist. So like a decade before, there was no awareness about the gynecological cancers as a clear subspecialty. But now we have developed many subspecialized gynecologists and surgical oncologists as gyne-oncologists. Patient experience is the cornerstone, as you know, that's the heart of all the medical practice is the patient care. And everything should be patient-centered and prioritization of the patient care rather than what we as doctors or physician or surgeon would like to do. So putting the patient in the core or in the heart of any clinical trial or in a study and know what are their needs, their unmet needs, the bridging the gaps of care delivery between several parts of the world. What do they feel? I can do the best surgery for my patient and I can give her the best treatment, but my patient can be unsatisfied. She can't be understanding what's going around. So it's all about quality of life and about patient satisfaction. So putting the patient in the context of a clinical trial and the studies, really, I see this is simply the heart of medical practice. Diversity in patient care in between different regions, in between different cultures, in between different resources, this should be thoroughly discussed. This should be thoroughly studied, because simply what applies for a patient in Japan doesn't apply for a patient in Europe. It will not apply for a patient in United States, and this is a totally different story from a patient in South America or in Africa or in North Africa or something like this. So simply we can't replicate what the guidelines and the evidence and the standard of cares in a place or in a region or in a society and then replicate it in another region. That's why we have to see the difference in everything, in the resources, in the cultures, in the religious backgrounds, in the financial aspects, and even how the patient look for the importance of life. You know, some regions, they don't see that life is so valuable for the patient. They don't see that life is a very important aspect. Simply, they see people around are being killed and are being losing their life. And so we have to study all of this. We have to inform all our health practitioner practicing that the patient is the core of our work. Simply, we work for the sake of the patients. So studying this diversity, seeing what's happening in South America, what's happening in Africa. Africa is very large, for example. So what's happening in Egypt is totally different from what's happening in South Africa or in Sub-Saharan Africa, for example. Seeing the resources, bridging the gap, trying to give the minimum standard of care for them. I believe this is a very valuable story. The trust between doctor and patient, this is the first step, and this is the key step between patient and doctors. Once you lose this trust, nothing will be done in a perfect way in the medical practice. There will be misunderstanding, there will be misbeliefs. You know, I like using the word healthcare providers, like rather than doctors or physicians, because simply we provide our patients with healthcare. So again, they should be satisfied. They should be included in the treatment plan. For example, I have seen in many regions patients who don't know about their treatment plans. They are just receiving the treatments. They are just undergoing surgeries without even knowing what the extent of surgery, you know, without informed consent and all of this. So the mutual understanding and the mutual respect and the mutual total trust between patient and healthcare providers, this should be the first step. And then after that, just simply we can go to the all other steps, from starting the treatment, doing the surgeries, giving the chemo, everything. one statement that I have been usually telling my medical students that life is all about experiences of others, reading the history and reading and just living the experiences and lives of others, and then you can do your own experiences, your own expectations, and doing planning for all the future. So what we do whenever we read books, we watch movies every day, we see lives of others, we learn a lot from movies, we learn a lot from reading books. Again, every patient is like a new movie, it's like a new book that you are reading. You learn from them, experiences about medical practice. You even they are like our teachers. They teach us great tips in medical practice. You see how they are complaining, how they are dealing with the part of medicine, but it's not alone about medicine. It's more about life, even especially in cancer patients and oncology patients. I have been working and networking with many organizations about cancer care and gynecological cancers, as I have told you in the introduction, that I work with the PARSGO, which is the Pan-Arabian Research Society of Gynecological Cancers. I work with the MIMAGO, which is the Middle East and the Mediterranean group of gynecological oncologists. Both are very active in gynecological cancer care delivery. I myself, we have created, and I'm the secretary of EGOS, with the Egyptian Gynecology Society. We work so close with the IGCS, with the International Gynecological Cancer Society, and with the ESGO, the European Society of Gynecological Cancers. So we have very close relationship with all the societies, and we work all together, of course, with the World Ovarian Cancer Coalition, to try to do something better for the patient of gynecological cancers in our region, not in our country alone. Lastly, just I can again emphasize that the patient experience, the patient satisfaction, the patient quality of life, this is the core of medical practice. This is the reason why we are there. So simply, if we don't try to satisfy all those needs, all those unmet needs, if we are not trying to bridge the gaps of delivering the standard of care of practice between different countries, so simply we should stop, we should quit and just watch others doing this. So again, it's all about patient and for the patient, and never forget that every glory, everything, every new innovation in the surgical techniques, in the treatment, everything should finally just pour into the patient.